My name is Phoenix Ramos, and I am an immigrant to Iceland. I'm from New York. I moved here about 6 years ago. I'm now currently here. I have 2 horses and 2 dogs and an Icelandic husband.
Yes.
Well, this is an issue that's near and dear to me. As you know, in my country, we have a privatized healthcare system. And as you also know in my country, it doesn't really work that well to have 2 standards of care for the wealthy and for those less fortunate. I have been concerned recently about the whispers I've heard regarding the privatization of the national healthcare system. And my question, the first part of my question to the candidates would be, how do they intend to fund the national healthcare system and keep it running for the foreseeable future?
We don't want to encourage inequality, and that is what happens with privatization in healthcare system. So we have like a big emphasis on running the healthcare system for free for everybody, and run by the government. Also, how to do it and how to fund it. We have a kind of totally different ideas than many others. We want to run the government a little bit differently with a different style. And also we want to tax, the rich people, which are not done. We want to, or not done enough, because we want, as I said before, equality, more equality in society. And we also want to tax the national resources fairly, so that the nation is getting something out of it, which is not the way it is today. So I think we can run a very good society here. We can run an amazing society here if we just change a little bit on how we run things, and we stop kind of giving it all away to the rich.
We have in place one of the best healthcare systems in the world, as can be seen in our COVID epidemic response. Specific arrangements have been made for private doctors under the public healthcare system to perform certain specific medical undertakings. Much as is done in other Nordic countries, like in Sweden. There is no need for concern, as it is the state that will pay the bill.
4 years in this government, the Minister of Healthcare has been from my party, the Left Green Movement, and her and our emphasis has been on strengthening the public sector of the healthcare system by putting a lot more money into it than has been done for quite a lot of years. So that is what we have been doing for the past years, and we want to keep on going in the same direction. We need to strengthen the public sector of the healthcare system, because that will benefit us all.
We have a public healthcare system and publicly funded healthcare system, and no political party in Iceland is talking about privatizing it. We have some parts of the healthcare system, the general practitioners and the healthcare centers, that some of them are operated by private entities. And most people don't realize that it is so. And these are the healthcare centers in Reykjavik that people are in and around Reykjavik that people are happiest about. So I want to differentiate between privately run and publicly funded, and then private healthcare. And nobody is talking about private healthcare and 2 systems.